going to shift our focus though now to the northeast, where there's been an extremely interesting development that we're reporting on. India's essentially reported its first documented case of a dual COVID infection in the northeast. Now, this has been reported in a double vaccinated doctor from Assam. This doctor was infected by both the Alpha and the Delta variants of COVID. Now, there have been a few of these incidents in the UK, in Brazil, in Portugal, but as such, a case like this hasn't been officially documented here in India. What does a dual COVID infection really mean? Dr. Borka Koti, senior scientist at the ICMR's Regional Medical Research Center, joins us from Dibrugarh. Thanks very much, Dr. Borka Koti, for joining us. What is a dual infection? What does this dual COVID even mean?
Thank you so much. At the onset, I would say in medical terms, when we say it's a co-infection, but co-infection with the same virus with a different strain. Generally, co-infection, we have a lot of, it's a common thing, co-infection to occur for respiratory virus like influenza with COVID-19 or RSV with influenza. It's a common factor, and in medical science, it's a common thing to have a co-infection. But what we are seeing out here is a dual infection or co-infection with the same virus, but with different variants. And why is it rare? Actually, it shouldn't be rare. It is a surprise that people are not detecting a lot of co-infection with different variants. The surprise is that we fail to detect these variants, and we are not looking at it. And these variants are generally detected during the transition phase of one variant replacing the other. And this transition phase, suppose the UK variant was very common in February, March, and early part of April in India, and most probably in Northeast India, actually. And then came the Delta variant that was originally primarily known as the Indian variant. So during that phase, simultaneously, two variants people may get infected with two variants simultaneously within a very short of period of time, maybe 1 week.
Right. That's actually the clarity that I want from you. Is it a simultaneous infection? You have symptoms of COVID, but you're infected with two variants parallelly. Does it happen simultaneously, or does one sort of follow the other?
It is a simultaneous infection, and in fact, one will overtake the other. The one which have a higher transmissibility and higher reproduction, I mean to say the replication rate, and they will be the dominant strain. Actually, what happened is that the UK variant, that is the Alpha variant, that is what we call the B1.117.
Right.
That variant was highly transmissible. It was more than 60% transmissible than the Clade Z.
Yes.
Earlier.
How is it diagnosed? Dr. Borka Koti, how is it diagnosed? Because this is one documented case, but you're saying that in that period between the Alpha variant and then the Delta variant taking over, there could have been several such people who could have had a dual COVID?
Yes. What we do in RT-PCR, we do not detect the variants. We just detect the positive and the negative. So it's the same virus. Actually, the Alpha and the Delta variant, they don't differ. They hardly differ by 0.2%, not even 0.2%, even they are similar, 99.8% they are similar. So the virus is the same. Some mutations are there, at least in the spike protein, they have around non-synonymous mutation that is sends in the amino acid sequence of around 8 amino acid sequence from the reference strain.
Right.
So what we get out here is that this virus is the same, the strains are different. And if we are not looking at the whole genome sequencing, even whole genome sequencing misses these variants because they appear, we have to look specifically at the point of interest.
Right. Will the disease, I'm going to interrupt you there because we're running out of time, but will the disease be the same if you have a dual infection? Will the symptoms of this kind of COVID also be the same?
It's the same virus and you will have the same disease actually. The Delta variant, because it will predominant because its replication rate is higher or its transmissibility higher. When you have a virus that is circulating, then already we get a lot of things like the quasi-virus species circulation in HIV and other viruses also.
All right.
So there may be some differences, but this is not a thing to worry about. It's like the single infection, whatever you get with Delta infection, you will get with
it's fascinating information, and thank God you're saying it's nothing really to be worried about. But the first dual case of COVID being detected there in the Northeast. Thanks so much, Dr. Borka Koti, for joining us.